Hello everyone, I am Dr. Prakriti J, Consultant Rheumatologist, Narayana Health, Mysore. Today I will be discussing about rheumatological diseases. April month is considered as Awareness Month for Rheumatological Diseases across India by Indian Rheumatology Association. What is arthritis? Arthritis means joint inflammation. Inflammation consists of pain, swelling, redness and loss of function. Arthritis can be a symptom in itself or a disease in itself. It depends on the number of joints that are getting involved. It can be 1, less than 4 or more than 4. One joint gets involved in terms of infection, gout or reactive arthritis, which are easily controllable. More than 4 joints are long-term diseases like rheumatoid arthritis, lupus, connective tissue diseases, scleroderma, etc. There are many phases of arthritis. It can also have skin problems like producing rashes, like in diseases of lupus. It can present as numbness or color changes in the tips of fingers, which is called as Raynaud's phenomenon, as part of diseases like scleroderma, which is far more dangerous than just an arthritis. It can present as joint pain and swelling in just one single joint, which is called as gout, which happens when there is increased uric acid in your body. Or it can also be part of skin problems like psoriasis. Psoriasis does not just affect skin but also affects joints, and it is multi-system disorder. If not controlled well, it can be dangerous. Arthritis can also present as back pain, especially in young males with very severe back pain, especially in the early mornings. It can also affect skin, intestine and eyes. Or it can be a long-term disorder where arthritis affects multiple joints, resulting in deformation and damage, which is part of diseases like rheumatoid arthritis. Or most commonly, as we see, it can be part of wear and tear in elderly people, which usually affects fingers or knee joint. It can be so severe that it can result in joint pains to such an extent that they might require surgery and replacement of knee. Arthritis means there is severe joint activity. If not recognized early, it can result in improper treatment or joint damage, which are permanent. It has to be recognized early, and not just that, it has to be treated fully. Providing half treatment or just enough to reduce the pain is not going to help, because it is a multi-system disorder. It needs to be treated in all the organs that are affected. All other organs need to be screened for whether it is involved or not, like joints, lungs, skin, eyes, nerves, etc. The longer we wait to start treatment, the damage is going to be more severe. So if you do have any types of symptoms which affect your joint pain, and if you have any doubts that it could be arthritis, kindly consult a rheumatologist at the earliest. And is that it? Can we treat it? Yes, of course, it can be treated and very well controlled. In disorders like gout, osteoarthritis and rheumatoid arthritis, which are easily recognizable because they affect your joints and it tends to be very severely painful. The sooner you present to the doctor, it can be controlled far more easily and effectively. As you all know, arthritis can also be part of a generalized disorder. This is far more dangerous. It is very subtle. So in diseases like lupus, Sjogren's, connective tissue diseases and sometimes even cancer, it can present as mild joint pains here and there, with other symptoms like skin rashes or involvement of tips of fingers or kidney problems. All of these needs to be recognized early, and only when put together it can be identified as part of a major disorder. This requires more severe treatment, aggressive evaluation, and hence it is wiser to present to your rheumatologist the sooner, so that you can be presented with an array of options for treatment, which will be helpful in the long run to prevent damage.